Imagine being completely fine one moment, and then suddenly feeling a sharp, gripping pain in your back that takes your breath away. You try to sit, you try to stand. Nothing feels comfortable. The pain comes in waves, rising, crashing, and returning again. For many people, this is the moment they discover they have a kidney stone. Today, we are going to talk in detail about kidney stones, what they are, how and why they form, the symptoms your body uses to warn you, the different types of stones, and most importantly, how you can treat them and prevent them from coming back. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes, and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. What are kidney stones? Kidney stones are hard, solid masses made from minerals and salts present in urine. Doctors may also call them renal calculi, nephrolithiasis, or urolithiasis, different names for the same condition. These stones form inside the kidneys, where blood is filtered and urine is produced. They can be as small as a grain of sand, or as large as a pebble, or even bigger. Kidney stones can affect any part of the urinary tract: the kidneys, the ureters, the bladder, or the urethra. And while some stones remain silent, others make their presence known in the most dramatic way. How kidney stones form. Urine normally carries waste materials out of the body, diluted in water. But when there isn't enough water, or when certain minerals become too concentrated, they begin to crystallize. Over time, these crystals stick together. Layer by layer, they harden, and eventually become stones. This is why dehydration is the most common and most important risk factor. Less water means more concentrated urine and a much higher chance of stone formation. At the same time, urine may lack protective substances that normally prevent crystals from sticking together. When both these things happen, stones form more easily. Why kidney stones can be so painful. A kidney stone usually does not cause pain while it stays quietly inside the kidney. The real pain begins when the stone starts moving. When a stone enters the ureter, the narrow tube connecting the kidney to the bladder, it can get stuck. This blocks urine flow, causing pressure buildup in the kidney. The ureter responds by spasming, and this spasm, combined with swelling, causes the intense pain kidney stones are famous for. The pain often starts in the side or back, just below the ribs. It may travel downward toward the lower abdomen or groin as the stone moves. The pain usually comes in waves. It can change location. It can suddenly become more intense. Symptoms. You should never ignore kidney stone symptoms vary depending on size and location, but common warning signs include severe, sharp pain in the back or side, pain that radiates to the lower abdomen or groin, burning or pain during urination, pink, red, or brown urine from blood, cloudy or foul-smelling urine, a constant urge to urinate or passing very small amounts, nausea and vomiting. If infection is present, fever and chills may occur, and this requires urgent medical attention. Seek medical help immediately if pain is unbearable, if you have fever and chills, if you see blood in your urine, or if you are unable to pass urine. Causes and risk factors. Kidney stones rarely have one single cause. They usually develop due to a combination of lifestyle, diet, medical conditions, and genetics. Not drinking enough water is the biggest risk factor. High sodium diets increase calcium in urine. High animal protein intake raises uric acid levels. Obesity increases the risk by altering urine chemistry. Digestive disorders, gastric bypass surgery, and chronic diarrhea reduce water and calcium absorption. Certain conditions like renal tubular acidosis, hyperparathyroidism, repeated urinary tract infections, and rare genetic disorders also increase risk. Some supplements and medications, including excess vitamin C, calcium-based antacids, laxative overuse, and certain migraine or seizure medicines may contribute as well. Types of kidney stones. Most kidney stones fall into one of 4 categories. Calcium stones. These are the most common. They are usually made of calcium oxalate or calcium phosphate. High oxalate foods, certain metabolic conditions, and excess sodium increase risk. Uric acid stones. These form when urine becomes too acidic. They are common in people with high protein diets, diabetes, metabolic syndrome, or chronic fluid loss. Struvite stones. These develop in response to urinary tract infections. They can grow quickly and become very large, sometimes with little warning. Cystine stones. These are rare and caused by a genetic condition called cystinuria, where the kidneys leak too much cystine into urine. Knowing the type of stone helps doctors choose the right treatment and prevention strategy. Treatment options. Small stones often pass on their own. Treatment may involve pain relief, nausea control, and drinking plenty of fluids. Larger stones may require medical procedures or surgery, depending on their size and location. The goal is always to relieve pain, remove the stone safely, and prevent kidney damage. Prevention: how to stop stones from coming back. Prevention is the most powerful treatment. Drink water throughout the day. Your urine should be pale and clear. Reduce salt intake. Limit excessive animal protein. Be cautious with oxalate-rich foods if advised by your doctor. Continue eating calcium from food sources unless told otherwise. Be careful with supplements and always discuss them with your healthcare professional. In some cases, medications are prescribed to control mineral levels, reduce uric acid, or prevent crystal formation. If you've had more than one stone, working with a doctor and dietitian can dramatically lower your risk of recurrence. Final thoughts. Kidney stones are painful, but they are also manageable, treatable, and often preventable. Listening to your body, staying hydrated, and making informed choices can protect your kidneys for life. You are not powerless against kidney stones. Knowledge truly is your strongest defense. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.